I'd like to welcome you today to the Gold Coast Plastic Surgery Podcast. I'm Dr. Mark Doyle. I'm a specialist plastic surgeon and I have more than 30 years experience. Today I have with me Kirsten, who is our inquiries advisor, and between us we're going to cover several different topics throughout the course of the podcast.
Mark, we are here today discussing breastfeeding, breast lift and breast reduction. Does it go together? Can it work?
A good question, as always. Thank you. It's most important to start this conversation with, if you want to breastfeed after any sort of breast surgery and breastfeeding is really, really important to you, you need to discuss this with both myself and your GP at length before we go into the discussions as to what sort of breast surgery you're looking for. Because if there's a really low risk that you might have problems with breastfeeding and that's a major problem for you, we need to know about that at the beginning of the conversation and not after the surgery. Breast lift and breast reduction are a very similar sort of technique usually in terms of the position of the scars, and it's the position of scars that make the most difference. If you're having a breast reduction and you have a large amount of breast tissue removed, and as the milk is made in the breast tissue and most of that's been removed, then you'll have less milk coming out than you would if you hadn't had the reduction. So that sort of is just by the by. If we look at the scars associated with the operations, both involve a circular scar around the nipple and usually a vertical scar below the nipple, the lollipop.
Yeah, the lollipop, that's what I let people know when they're inquiring.
Which would be the commonest way to do these procedures. Because there is surgery around the nipple, it is potentially possible, but generally not an issue, that you may have some problems with the sensation of the nipple, and you may have problems with damage to milk ducts, which are connected to the breast tissue, which is where the milk is coming from. So those things need to be taken into account. It's often really difficult to be able to predict beforehand whether it's going to happen or not. But obviously if we're doing a procedure where we know that breastfeeding is a major problem for the patient, then we do everything we can to minimise that.
Yes, and we aim to educate and inform as much as possible before, and you really shouldn't have any questions before you go ahead with surgery. So these are important to know before you move forward, or even just if you're researching options into breast lift or breast reduction surgery. So really important. And I also wanted to touch on, a lot of people ask if you remove the areola or the nipple during the procedure. And I know we mentioned lollipop incision, so a little bit more about that.
Both these procedures, both the reduction and the lift, which have a circular scar around the nipple or the areola complex, the nipple never comes off. So it stays on, it stays connected to the milk ducts underneath, and it stays connected to the nerves underneath. So, as I was saying previously, the most likely outcome is that there is no damage to the milk ducts, there is no damage to the nerves, and breastfeeding would go ahead as normal for that particular person, because some people can breastfeed, some people can't.
Yeah.
The only exception to all of this is for ladies that are having a really large breast reduction, and this is really large breasts, there is a procedure where the nipple is removed completely, the breast reduction is done, and then the nipple is grafted back onto the breast. In that circumstance, the nipple is not connected to the breast tissue at all, the milk ducts are not connected, therefore you have a nipple that has no sensation and it has no connection to the breast. Those people cannot ever breastfeed.
Right.
But again, that's a very, very uncommon operation. But some people do it, and you need to be aware of that before you have your surgery. Logic would say that if breastfeeding is really, really important to you and you don't want to have any risks at all of not being able to breastfeed, my advice to you is have your family, get your breastfeeding finished, and then consider surgery after that.
Well, thank you so much for that important information, and I'm sure that everybody's feeling a little bit more informed and educated about breastfeeding, breast lift and breast reduction surgery.
You're very welcome.